Hi, my name is Salda Ishkin, and today we'll be talking about schistosomiasis, the deadly neglected tropical disease. So what is schistosomiasis? It's a disease caused by parasitic worms called blood flukes that are associated with freshwater snails. It is prevalent in tropical and subtropical regions, particularly in poor communities without access to clean water and proper sanitation. This disease infects almost 240 million people worldwide in 78 countries, and more than 700 million people live in endemic areas. It is considered the second most common parasitic disease following malaria. So why is schistosomiasis a major public health concern? This is because it is the most deadly neglected tropical disease because it kills more than 200,000 people in Africa each year. More than 20 million cases develop severe and disfiguring disabilities, and children with chronic disease can suffer from anemia and malnutrition, which contribute to days lost at school or pervasive learning disabilities. In 2008, it was reported that only 8% of those infected had access to medication. There are 5 different species of schistosomiasis based on geographical distribution. The different species can lead either to intestinal or urogenital complications. In the lower right-hand corner, we can see the distribution of schistosomiasis in 2009. The highest prevalence being in Africa, with low to moderate prevalence in countries in South America and Asia. So how is schistosomiasis transmitted? It's transmitted through direct contact with contaminated fresh water inhabited by snails that carry the blood flukes called schistosomes. The larvae use the snails as a host and multiply and mature, and once the mature larvae are released from the snail and swim, they come in contact with an individual either swimming or bathing and penetrate the skin. Inside the body, the larvae migrate to the lungs, heart, and liver where they mature. The mature worms then migrate to the blood vessels where the female lays eggs. The eggs can either be retained in tissue or excreted out of the body in urine or feces. If an infected individual urinates or defecates in fresh water, they spread the eggs of the schistosome, which migrate to the snails and begin the life cycle again. Some signs and symptoms include itching and rash at an infection site known as swimmer's itch. Flu-like symptoms develop such as fever, chills, muscle aches, and cough. Chronic symptoms include abdominal pain, bloody diarrhea, bloody urine, anemia, enlargement of the liver, spleen, or lymph node, and children with repeated infection can develop malnutrition and learning disabilities. Here are some images of the physical appearance of the symptoms. In this image here, we see the swimmer's-like itch and the enlargement of the spleen and liver in this image. So the diagnosis includes parasite eggs can be detected in stool or urine samples. Antibodies or antigens in blood or urine samples are indicative of infection, and serological or immunological tests may be useful in showing exposure to infection. Other tests for urogenital or intestinal schistosomiasis include filtration techniques or methylene blue stained cellophane. How is it treated? Primary form of treatment is praziquantel, an antihelmintic drug used for the treatment of tapeworms and flukes. A single dose of praziquantel has been shown to reduce the severity of symptoms in subsequent reinfection, and pharmaceutical companies like Merck are donating as many as 250 million tablets worldwide for as long as they are needed. Case management of this disease includes treatment of underlying symptoms and stabilizing patients who have acute complications. Compliance with medication is also necessary. Although not directly contagious, avoiding cross-contamination by urinating or defecating away from fresh water will establish good sanitation practices. Also, taking measures to purify water via boiling or other means can help manage the disease. High-risk groups include people who come in contact with freshwater sources that contain these disease-carrying snails. Children under the age of 14 are highly susceptible, and individuals who reside in one of the 78 countries where the disease is highly prevalent, mainly in Africa. Prevention strategies include vaccinations. Although there are no vaccines currently available, there is a vaccine under the early stages of development. Educating communities about the risk of disease transmission by bathing in freshwater lakes and ponds can be an effective prevention strategy. Mass drug administration to distribute praziquantel to high-risk communities can be an effective strategy as well. Removing snail populations from freshwater bodies will remove the host of transmission and also prevent the transmission of disease. It is important for global partnership with organizations, public health professionals, pharmaceutical companies, as well as involvement of the community to raise awareness of this neglected tropical disease to prevent further populations from being inflicted. Thank you for your time.